Welcome to DocPod. Hear health.
Well, I'm here with Dr. Archelle Georgiou, and I appreciate you spending a little bit of time with me this morning. I could take almost the whole episode going through your experience, titles, accolades, but we'll go through maybe just a couple here. Firstly, the author of Healthcare Choices, 5 Steps to Getting the Medical Care That You Want and Need. And in that book, highlights the CARES model, which we'll go over in a little bit. Is also a regular contributor on KSTP TV as a medical expert in St. Paul, Minnesota. Well on your way to becoming my friend. So I'm excited to spend some time with you here this morning. Thank you for sharing it with me.
Absolutely. And that last part is the best part because life is all about relationships, right?
Very, very much so. And the time that we spent, albeit limited, has kind of opened my eyes into maybe personal choices that I'm making and will make in healthcare, and just the way that you relate to people, but namely and especially me, because it's been my experience, is very, very welcoming, very warm. So I appreciate that very much for somebody that just met you, and I know that people that call into the show and or send you messages online, I'm certain that they feel the same way with the way that you respond to them. So thank you for that.
So thank you.
Absolutely. And also happy November 8th. So
I love this day.
And we spoke when we first talked. You walked me through some reasons why this day is so very important to you, and it's unbelievable how some of the more pivotal moments in your life happened on November 8th. I won't be able to tell it as well as you can. So if you could maybe start, I think, with your father's name day, and then into the rest into today, which is November 8th.
Absolutely. Thank you for letting me share that. So November 8th has been a special day. As you just alluded to, November 8th is my father's name day. I'm Greek. I'm a daughter of Greek immigrants. And in the Greek tradition, people celebrate their name days, their saint's day, even more than their birthday. So my father's name was Michael, and November 8th is the day that we celebrate Saint Michael. And it was a day in our home when my mom didn't put out any invitations, but everyone knew that our home was open and we could have anywhere from 10 people on a weekday to, if November 8th fell on a weekend, we could have 50 people, 60 people at our home.
Oh, wow. Mm-hmm.
Always a special day in our home. November 8th was also the day in 1951 that my mother arrived from Greece on the boat, independent of my dad. They met in the United States, and my parents have given me all the gifts of life and in life. And so I really appreciate that that was a special day because they both realized the American dream. And then many, many years later, on November 8th of 1999, I probably achieved the most important thing I can point to in my career, which is that on that day, I was at UnitedHealth Group, UnitedHealth Care as the chief medical officer. We had been for a long time planning to eliminate prior authorization review, medical necessity review, the bureaucracy that interferes in the patient-doctor relationship. So we had been working on it for months and months, but on that day, it hit the Dallas Morning News and every single news station and newspaper in America. It was based on the PR firm that we used, it was the 5th biggest story in America that year, behind the Egypt air crash and JFK Jr.'s death. So I'm really proud of that moment because it not only was a big change in UnitedHealth Care for the doctors and patients that we served, but it also drove an industry sea change. Really proud of it.
And also, I think I got a pat on the back from Bill Clinton at the time, correct?
It did. Yes, it did. Yes. And from the head of the American Medical Association and so many others. And for the next year or 2 years, I was everywhere from the White House to speaking to the Surgeon Generals of the military branches, to the United Nations. And so it was a big deal. And I take credit for maybe orchestrating or architecting that strategy, but it really took an entire enterprise and organization and mostly the courage of our chairman and CEO at the time to support that very unorthodox approach.
Well, and as someone who has been on the receiving end of not being prior authorized or having to go through that process many, many times with other organizations, I thank you for the general public.
Thank you.
And also, November 8th, 2024, guest on DocPod. So, another really pivotal and seminal date.
Day, so
Very
important.
much so. Well, I'm glad to have you on. And speaking of podcasts, you host your own. The podcast is called To Speak Up for Your Healthcare. Tell me a little bit about that and talk to me about kind of the journey through it and some of the things that you cover, topics, what the format is.
Sure. So Speak Up for Your Health is a podcast where I interview guests who are patients who have faced their own obstacle in navigating the healthcare system. And so we talk about what that journey looked like, how they navigated, how they overcame those obstacles. And I give some advice along the way about what they did right, what they may have been able to do a little bit differently. But the whole purpose of the podcast is for listeners to hear that you don't have to be a doctor to advocate for your health. And that's what I really try to emphasize in the podcast is these are normal people, not necessarily with a clinical background, very few have a clinical background, who figured out a way to speak up, to be present, to be a partner in their care. And I want to share those stories. So the whole goal is to empower people to do the same in their own life when they face an obstacle. And their stories can range from needing to know that they have alternatives in their care that they need to ask about, to working with their insurance company if they've had a denial, to being advocates to their own selves, because sometimes we are our biggest barrier. So the range of stories is broad.
Well, it sounds like a lot is really well. It's your life and your methodology and your approach to healthcare, and I think just with relationships in general, there's a lot of dotted lines from what you just said with a lot of subject matter in your book, which I read and is amazing. And I'd mentioned before, but I've got about 12 pages dog-eared here of things that jumped off of the page to me, and I wanted to talk a little bit about that and go into some detail about the CARES model that you detail in your book. And we can go through that, but just as a highlight or overview, maybe it's understanding your condition, knowing your alternatives, respecting your preferences, evaluating your options, and then starting to take action. And some of the things that I mentioned on that is, the first, knowing your condition, the so what and the why bother. So I think that is probably, it's the first step, right? So it's very important that it starts with that. But the so what to me that's extremely important, because this hurts. So what? Or I'm coughing a lot, and so what? Or I have a history of this and I'm starting to feel XYZ. So what? And so if you could just, briefly highlight that CARES model and walk me through the approach into healthcare and treating yourself or having yourself treated, and also maybe other life applications if you can.
Sure, absolutely. Well, the first step, the condition, know your condition, is the most important. Because it's so important if you have the wrong diagnosis, you can get great treatment, but if it's treating the wrong thing, it's not going to help. Mm-hmm. And, research shows that even among the most literate and health literate individuals out there, that many of us don't understand the details of our condition. Now, I don't suggest that people need to be clinically trained and know that level of detail around their cancer or their hypertension or their diabetes or whatever their condition may be. But you need to know enough to understand why you should bother. Let me give you an example.
Please.
So many people in the United States have hypertension. They know that they have high blood pressure. Maybe they're on a medication and they might know the numbers, the systolic and the diastolic blood pressure. But when you ask them, well, why bother treating it? They can't tell you why. And I think it's really important for people to understand. So let me just give you a brief example of, how I describe high blood pressure to people. So what? In a very simple way. It is that your heart's a muscle. Every time it's pumping against a higher pressure than it should be, it's like doing a mini workout. So imagine lifting weights 24 hours a day, 70 times a minute, 1 billion times, right? Over a course of time, how tired you would get. Your heart gets that tired. And so just reframing the so what of people understanding that your heart is getting tired with every beat may help motivate them to be more adherent with their medication, be more aware of symptoms that pop up that could inspire them or cause them to go to tell their doctor about them. And so I think that knowing your condition is really important. When we look at patients with cancer, there are so many patients with cancer, the studies show, that don't understand whether or not it's aggressive or not aggressive, what their treatment options are, because they don't understand the state of the cancer itself. And so even people that are undergoing massive treatments, bone marrow transplants, when surveys show, when they really try to investigate how much does that individual understand, they don't. And so when you don't understand your condition, you can't be a partner in your care.
And I think that analogy is excellent, because when I read that in the book, I thought, I've never thought about that way. And I never, and I'm relatively medically educated. I do research on anything that I've ever had, but I read voraciously. And with that said, I read that line in your book and that analogy. I said, I've never thought about it that way. And now it's seared in my brain, where I'm like, well, if my blood pressure is a little bit off, I just did an extra 2,000 workouts today with my heart. And I know how tired and exhausted I get if I do a hard workout in the gym, because that's me working out. You don't think about your heart lifting weights every day. So it's an excellent analogy. And I think, a lot of people will be able to relate to that, say, oh, I've got high blood pressure. So what? But also, so what? Well, this is what. So, yeah. And the next, next part of the model is knowing the alternatives. And so it's the so what into what else. And so talk to me a little bit about what that means and how and why that's the next step.
Sure. So often we go to a clinician, a doctor, they make a diagnosis, and they lay out a treatment plan that they're most comfortable with. Sometimes, most of the time, it's one option, but there's never one option for treating any condition, not any single one that I'm aware of. And so I think it's really important that you know all of your options before making a decision. Let me give you another example.
Please.
There's so many individuals, many men, who have sleep apnea. Many are still undiagnosed. And for anybody that is not familiar, sleep apnea is when you not only have snoring, but you have snoring with gasping, with periods of apnea, of not breathing during the night. Your brain isn't getting enough oxygen. So sleep apnea. If you go to an ENT doctor, they can adequately diagnose that sleep apnea. And if you do have it, they're most likely to prescribe a mask, a CPAP mask. And that works. It's fine. But just imagine how uncomfortable it is for an individual to be sleeping with a mask, with a machine that makes noise, having a partner in their bed. It certainly is an option that works, but adherence rates to using that mask are very low. I use this example all the time. And some people in the audience always have sleep apnea. And I ask, how many people with mild or moderate sleep apnea were ever given the option of using a dental device? So if you have mild or moderate sleep apnea, an evidence-based alternative is to have what's called a mandibular advancement device. It's like a really glorified retainer. It's done by a specialty dentist. They put a mold in your mouth, and that retainer moves the jaw forward ever so slightly to open up the airway when you're sleeping. Think about how much more comfortable that is if that will work for you. But ENT doctors aren't specialized dentists. They're used to prescribing CPAPs, and patients aren't always presented all of the alternatives. So I recommend ask what else? What are my treatment alternatives? Does everyone with this condition get treated this way? Those are questions that can open up the dialogue with the practitioner about what other options you have before you make the decision about how you're going to be treated.
And I think that's very empowering too, because the encouragement to ask your PCP or even a specialist about something else that might work for you, or about another potential treatment for fill in the blank symptom. It's probably pretty intimidating for somebody to go into a physician's office and make a suggestion, right? Or say, well, what have we tried this, or do you know about this? Because they're the expert as far as you're concerned, and but they don't have specialty training in multiple other things. They are the first line of defense with broad knowledge in quite a few different areas in medical specialties, but again, not in a subspecialty. So they're there to refer, but without you asking, sometimes that may not happen. So understanding, and we talked about this before, when we first met, but physicians are humans too, and being on the same level as a provider or a patient, but having kind of that shared decision making and understanding what you need and maybe what you know and what you don't know, right?
And that's really important to recognize in yourself what you know and what you don't know. I get a little bit of pushback from people when I say you're a partner in your care, you're on a level playing field with your doctor. I honestly believe that, but let's make sure that what I mean is well understood. It means that your doctor is an expert, highly trained in diagnosis, treatment plans, and everything that goes along with medical training. But you are an expert in yourself, your preferences, your priorities, your values, what works for you, what hasn't felt good to you in the past. And so it's when you find the Venn diagram of their expertise and your preferences, priorities, and values that you can come up with the right treatment plan for you. When you don't speak up to articulate what's important to you, what you're doing is abdicating to your doctor the responsibility of making an assumption of what's right for you because you haven't spoken up. And so I often will tell people it's your responsibility. Otherwise, you're abdicating it if you don't state what's important.
And I mean, that's a perfect segue into the third letter, if you will, but of the CARES model is the respect your preferences, right? What do you and what do you not want? There's an example in your book of someone who has an aversion to needles, and there's a particular treatment that they're looking to get, and I don't want this because I don't want a large tube in my body, and I hate needles and all these things. What can I do? And you also, on this note, you sent me an article just before this conversation, talking about the FDA recently approving a blood test for colon cancer detection, which is more comfortable and more convenient. And even more coincidental, I spoke with my sister-in-law about that 2 weeks ago, and I had never heard of it. And she mentioned it. She said, well, this is something that is brand new. So you sent me that article and I read this in your book. So I want to talk a little bit about that and, what respecting your preferences means and how you can apply that in a conversation with a physician, in creating a care plan or a treatment plan for yourself and that roadmap that you talk about at the end.
Sure. Well, respect your preferences at a high level means what's important to you. And if you ask someone what is important to you in the context of this health condition, they'll say, well, I just want to be better. Well, let's take that a level down, because being better, I believe, falls into three categories to really think through that. One is medically. What's important to you medically? How much risk are you willing to take? How much uncertainty are you willing to take? How much discomfort are you willing to take? That's in the medical category. But there are other categories that are important to consider in what's important to you. There's the social, personal, quality of life category. How do you feel about a large scar versus a small scar? How do you feel about, if you have breast cancer, for example, the impact on your sexuality? All of those issues become important. And so you need to consider them. And then there's the financial category. How much is this going to cost? And financial doesn't just mean money. There's so many moms and women who are caregivers. There's certainly men who are caregivers, but so many women. And having surgery for breast cancer may allow them to more immediately go back to their caregiving responsibilities with their children rather than having a series of 18 radiation treatments that they have to go through on a regular basis. So all of those things are important to take into consideration. If I may, I'd love to give you one story that is
Please.
an amazing one. There was a woman who was in her 30s and a stand-up comedian. And while she was on the stage, she collapsed on the floor, and everybody thought it was part of her comedy routine. It wasn't. She had sudden cardiac death.
I remember this.
They
Yep.
revived her 7 times. She went to the hospital, and when she was stable, they said, "Oh, you need an implantable defibrillator, or else this could happen again and you'll lose your life." And they described to her that it would be placed in the center of her chest, because that's where it has to be placed for the leads to go into the heart so that it works.
Mm.
And she looked and she said, "No, I don't want that implantable defibrillator." And they thought she was crazy because it would save her life. And she explained, she articulated that if she had a device in the center of her chest during her stand-up comedy routines, she wears low-cut dresses, it would be too obvious and distracting. She didn't want to risk her career. She'd rather not be here. And they paused and they said, "You know what? We could just put that implantable defibrillator in the skin underneath another part that would be concealed by the dress, and nobody will ever see it." Such a simple thing. So it's not, do I have a defibrillator or not? Do I have the surgery or not? Bringing up your preferences and priorities opens the discussion of alternatives that could be ever so subtle, that could be life altering.
Very much so. And that's, I know that story. I did not know the follow up. And that's interesting and impactful as well, because, a lot of times people wouldn't think to say that, or it would just be, no, I'm not doing it, and maybe not give the explanation. And also, on the flip side of that, the physicians, they have to get a lot of credit as well, because thinking of another option to be able to do that, as opposed to, oh, you're not getting this. Okay, fine. And then having to go about your life without it and risking death or anything else is, good on them.
Absolutely. Kudos to everyone involved in that story.
Very much so. And another example I wanted to pull out from your book as well, that we talked about a little bit before, but with the evaluating your options, was an anecdote that you gave about a woman named Cheryl, her son named Preston. Son was 13 years old, had hip dysplasia, had been to a couple of physicians who recommended different things, but both of which were not necessarily specific to a 13-year-old, and could have had life-altering consequences if and when that took place. So wanted to talk with you about that, and your recommendation ended up, I guess, saving the boy's quality of life. But I almost started crying when I was reading this story. So if you talk a little bit more about it, that'd be great.
Jeremy, that was a crazy story. And I'll tell you why. So as you mentioned earlier, I've been on TV for a long time, being the health expert on various stations. And when I was doing the morning show, following my segment, I would chat live with viewers who could ask me questions. Never treat anyone online. I want to make that clear. But people could ask me questions. Now, it always blew my mind a little bit that people would ask the TV doctor questions that they hadn't already asked their doctor. So let's just think about just how interesting that is. One of those questions came from Cheryl, the mom of this child, who was desperate to get another opinion about options and alternatives that her 13-year-old son might have, because she was terrified that at 13 he was going to have a hip replacement that would affect the rest of his life. That was one of the situations where I got actively involved. Again, not treating him, but just saying, let's talk offline. And I found 3 pediatric orthopedic surgeons in other parts of the country, including one in Minnesota where they were living, that could give them an alternative opinion. They had the resources to go where they wanted to go. They ended up going in Minnesota and had such an outstanding, they had an outstanding consultation that gave them hope. And then they ended up going with that doctor. And I have to say, I've never met this family in person, but they sent me a picture when Preston came out of the operating room. I mean, it brings me to tears even now, because I was so honored that they felt like I was a part of giving this young man some, a quality of life that he may not have had. And so there's stories like that that make my heart just, it's important.
Well, and I have to appreciate very much your humility as you're telling some of these stories, and as I read through your book and understood how you got to where you are, was just a math equation. And it was, call it 30, 35 years ago, but even so, you were in practice in San Francisco, and you sat and you thought for a minute, and there was the equation of, well, if I see X patients per day and I work for X amount of years, it's somewhere in the, I think it was 200,000 range that you would be able to affect throughout your career. And that wasn't enough. And how do I do more? How do I help more people and touch more lives? Which moved you into working for Cigna, into UnitedHealth, into the prior authorization, which impacted millions of lives. And I know I'm talking a lot, but it was impressed upon me that you and your practice and just your personality and you as a human, you're the epitome of what a healthcare provider should be. And I think people should aspire to be this way. So I appreciate all of the care that you provided. I, all of that to actually ask a question and let you talk because this is your time. But if you can, maybe just talk to me about your journey. If you want to Cliff's Notes it or tell as much detail as you'd like, starting that practice, going through what you went through, and understanding that there was a higher calling for you in not just treating patients, but being able to make an impact on more.
Sure. Well, I do have to start where our whole conversation started, which is that my family immigrated from Greece. My parents immigrated from Greece. And I just think it's unbelievable that the daughter of these individuals who didn't even finish elementary school were able, like I had the opportunity to go to Johns Hopkins University Medical School and get this education. The greatest gift ever. So I do have to start there, and I did practice, and I loved every single minute of practicing medicine. I loved the patients. True, over the course of a lifetime, it would be a limited impact. I mean, 200,000 isn't bad, but it is. And it was combined with my frustration with the managed care system at the time. This is early 1990s in California, where there was even more heavy-handedness and less sophistication in health insurance companies than there is today. So all of that drove me to get into the healthcare industry. Crazy thought. I wanted to get in and change it rather than just complain about it. That is my personality. Mm-hmm. And so I did. I started with Cigna. I went to UnitedHealth. I kept getting promoted on the West Coast from being the chief medical officer for San Francisco to California to the West Coast, and was invited to come to Minnesota to become the chief medical officer of the company. What an amazing opportunity. And did great things like what we talked about, as well as initiated using predictive modeling and artificial intelligence back in 2002. We did stuff like that. So, but I do want to tie this journey together with what you were just talking about and having an impact, because yes, I did make decisions in the context of United that affected at that time 17 million people at a time. And I'm really proud of that. But subsequent to that, I did so well, I was promoted to being the CEO of a wholly owned subsidiary of the company. I had $420 million worth of revenue, 1,700 people, 26 sites, and I was the CEO, hired a chief medical officer to work for me. And it was one of the most unhappy times of my life, because my title and my compensation were great, mm-hmm. but the number of people I was impacting, I was more in a business role than a clinical role. Mm-hmm. And I found that I would come home and I just wasn't as happy. I was stressed. I was unhappy. And it took me 2 years to realize that. But it was when my income and my impact were misaligned that I realized I needed to make a change. And I would encourage everyone to think about that. When I was in California in the early days of United, when I was chief medical officer, my income and my impact were following the same trajectory up. Right. Awesome. But when they became misaligned, and I graph it out because I'm a data geek, I can graph it out for you and you can see this gap. And I think that's when anyone should make a change. When their impact and their income are misaligned, it's time to think about, how do I bring them back into alignment, because that's what we're here to do. I mean, I wake up every day. I could work 24/7 and never feel like I'm working because I'm aligned. So anyway, that's that story. So in 2008, to wrap it up, I exited from the company, very good terms, and started my own consulting, which is a portfolio of activities. And I would now describe myself as a patient advocate who happens to be a physician. And I'm a patient advocate in a number of different ways. I certainly do it in the media. I do it through my book. I do it through my podcast. I am an advisor and on the board of directors of companies that create technologies that focus on making it easier for people to navigate through the system. And then I'm also a personal medical advisor to some individuals who just want me to handhold them in getting them through the system. And I love all of what I do.
Well, I was going to say, I'm pretty sure the people that work with you and that you consult love everything that you do for and with them as well. And would say that this has been an absolute pleasure. I love what you do, and I love that you came on the show to spend some time with me. I hope we can do that again very soon.
Absolutely.
Thanks very much, Archelle. Good to meet with you, and I will talk to you soon.
Thank you so much.